metabolic syndrome and lupus. But my sort of point today is how much it increases your chances of having tons of inflammation, which is what we're trying to suppress when we have lupus and autoimmune disease. We're trying to get that inflammation down. So exercise and quit smoking if you are smoking, lose weight, and adapt the diet. So losing weight, a BMI under 25 but not lower than 18, that's your ideal. Studies have shown a link between weight gain and chronic inflammation. You already have lots of inflammation with lupus, and we really want to get that inflammation down. So getting to and maintaining a healthy weight is a really important tool for addressing inflammation. Studies also suggest that the visceral, or that tummy fat, that apple fat that we talked about, actually releases inflammatory chemicals. So if you have a lot of fat around your belly, it's releasing inflammation, chemicals that cause inflammation. So we want to get rid of that. So one of the tools that I like is a Mediterranean diet, which reduces the risk of metabolic syndrome and reduces inflammation. The components of a Mediterranean diet are whole grains, which gives you high fiber, fish, because that gives you that omega-3 fatty acids we talked about, olive oil, which who doesn't love olive oil, fruits and vegetables, antioxidants, and red wine. I'm so happy about that. The other thing is a low glycemic load diet. In other words, because diabetes and blood sugar elevation can add to this metabolic syndrome and the inflammation we're talking about, really balancing out your blood sugar. So eating frequently instead of like a sumo wrestler. Sumo wrestlers don't eat all day, and then they eat like a ginormous meal at night, and they weigh like 5,000 pounds. So we want to eat all day long from the minute we get up, every 2 to 3 hours. It really decreases inflammation. It keeps your blood sugar stable. It's super important. Some good complex carb, like a whole grain cracker with some fat or protein, like a piece of cheese, or an apple with peanut butter, carrots with hummus. And choosing foods with low glycemic index isn't as important as your total load. So again, eating an apple with the peanut butter, it really balances things out. Trans fats, again, is something that you really want to get out of your diet. It's a huge inflammatory factor. I cannot talk enough about how damaging and inflammatory trans fats are, and it's so easy to take them out. You want to look for foods that say partially hydrogenated or hydrogenated on them, and that's all you have to do. Just turn the box over. If it says hydrogenated or partially hydrogenated, find a substitution. It can still say no trans fats per serving. Turn that puppy over and look at the label and make sure it's actually not in the ingredients. There's some great sugar alternatives out there for people like me with a sweet tooth. Stevia, xylitol, agave in moderation. But there's some really great alternatives to sugar if that's something that's hard for you to give up. They did a bunch of studies on diet soda and metabolic syndrome and weight loss, and there was a 34% increased likelihood of having metabolic syndrome with diet soda. The theory is that drinking diet sodas confuses the brain, and it's hard to know when to stop eating other foods. So really trying to maintain a healthy weight by adding fiber, choosing healthy fats, checking out some Mediterranean diet. This is just giving you an idea. It seems so abstract and simple, but it really can reduce your inflammation and help you lose weight too.